All right, class. We are in chapter 6, and this is going to be your musculoskeletal system. Of course, your musculoskeletal system is like the muscles and the bones, and they work together to frame the body. So we are going to talk about the musculoskeletal system in the anatomy factor and the medical terminology factor. Some important facts that you probably will see on your test, y'all. This right here. This little blurb right here, this first paragraph. We have 206 bones in our body, and we have more than 600 muscles, ligaments, and tendons and cartilage in our body. And also some important facts that you might see is that the skeleton is divided into two parts. That is the axial skeletal and the appendicular skeletal. And the axial skeleton consists of bones of the skull, the hyoid bone, the chest bone, and the spine. And the appendicular skeleton includes the remaining bones of the upper and lower limbs, the shoulders, and the pelvis. Now, the primary function of the musculoskeletal system is to protect the organs in the body and as well as movement in the body. The skeleton is the basic framework of the entire body, and the bones contain and store calcium and produce blood cells. So these are some things that you need to make sure that you remember on the test. Let's see. The muscles assist with heat production. These are some of the functions of your muscles, you all. They assist in heat production, locomotion, and posture. And there are three basic muscle types. First, you have the striated skeletal muscle, the smooth visceral muscle, and the cardiac muscle. The musculoskeletal system includes mostly striated or involuntary muscle. Now, the cardiac muscle is found in the heart muscle, and it is a smooth muscle that is involuntary. So, of course, we've said before, we don't want our heart to beat on a voluntary basis. Now, ligaments attach to bones and to other bones, and tendons attach muscles to bone. That's an important fact that you might see as well. Ligaments attach bone to bone, and tendons attach muscle to bone, whereas cartilage acts as a cushion between bones in the joints. Okay, so know that hierarchy as well. You all have this little skeletal diagram in the front of your CPT book, so make sure you know where it is. If there's any notes that you need to take pertaining to your skeleton, here is the best place to do it. Here are your muscles. Know where it is. So if they ask you something about the sartorius muscle, you know that here's your sartorius muscle. Okay? Okay, and it's the posterior aspect of the muscles. These are some key terms, y'all. Again, I know it's been a while since you had medical terminology and anatomy. Make sure you know this medical terminology. Make sure you know these approaches, such as now these right here, y'all. Axial mass. You need to know what that is. You need to know the definition of manipulation. These are important. Reduction. Know these now. Decompression. You need to know these terms because they're going to use them, and they're going to use them in a respect that you almost have to know what it is that they're talking about. Internal and external fixation. Approach. Instrumentation. You need to know what instrumentation is. Sprain nomenclature. You need to know that. What the scapula is. Then you have, coming on down here, you all, you have some fracture eponyms. Know what a Colles fracture is, and fracture of the distal wrist or That's what a Colles is, the distal radius, okay, or the wrist. Smith's fracture is a type of Colles fracture, except the bones are displaced towards the palm. A Jones fracture is a stress fracture of the fifth metatarsal, excuse me. A Salter-Harris fracture is an epiphyseal plate fracture, common injury in a child. A Dupuytren's fracture is a fracture of the distal fibula with rupture of the distal tibiofibular ligament and lateral displacement of the tarsals. Then we have the Montilla fracture. This is a fracture of the proximal third, the third of the ulna, associated with the dislocation of the radial head. Then you need to know what terms like osteomyelitis. Here we go, medical terminology. What cartilage is. What is a curette? Bunion terms. Make sure you know these, y'all. Write them down if you can't remember them. Okay. No man's land is a term for the sheath of the flexor tendons of the hand, especially in the zone from the distal plantar crease to the proximal interphalangeal joint. Stiffening following injury is a common problem in this area. Know the different muscles: the flexor muscle, the extender muscle, the adductor, the abductor. Polydactylous digits, know that, an extra digit, that's all it is. A colectomy, removal of a large portion of the dorsal metatarsal head associated with bone spurs. Okay. So make sure y'all go back and you read up on this stuff. Make notes if you cannot remember it. All right. How to code acute versus chronic. Of course, you already know. Acute always comes first, and chronic conditions linger on and on and on. So they're always going to be there in most cases. So we want to take care of the acute issue at hand first. Then we go and we address the chronic. Okay. All right. Make sure y'all go back and y'all study over this stuff right here. The different types of fracture, and I think we've talked about these before, you all. The comminuted fracture, the impacted fracture, the simple fracture, green stick fracture. Remember I told you are found in kids because their bones are not completely calcified. Pathological fracture, well, you know, path is disease. Study of a pathological fracture is a fracture that is caused by a disease process, such as if you had like osteomyelitis, it would brittle your bones. A compression fracture, a torsus or incomplete fracture, you all, and there are some diagrams on these different types of fractures as well. So make sure you know those different fractures. E-codes, you all. Now you remember insurance companies, when you do have 800 codes on your list, they want to know what happened. The E code is what tells what has happened in that patient. So they want you to explain to them what has happened. Make sure you go back and you look over this stuff, y'all. All right. So have a chance, make sure you go back and you read over it. It's very important. We have some HCPCS level 2 and modifiers, you all, that are used in this section. Of course, a modifier 50 for the bilateral procedure. Some payers sometimes may want you to append a RT or a LT instead of modifier 50. Other modifiers used in this section are 54, 57, 58, 59, 62, 66, 78, and 80. Make sure y'all know those modifiers are acceptable in this particular section. We're in the musculoskeletal system. And also some other modifiers that you would see are the LTRT, FA, F1, F2, F2, 3, F4. Make sure you know what modifiers are found in this section, and you can go through and you can write these down if you want to keep up with what modifiers would be acceptable in this particular section. Also, as always, this is a chapter review. If you feel that you want to go through and complete these questions and it's helpful, I do say that it will be a helpful tool for you to go through and review these questions. So make sure you go back, read over them, answer these questions. All right. Just make sure you can stop it at will and read these reports and answer the questions that follow. All right, that's it for chapter 6, you all. We'll pick up with chapter 7 in just a minute.